Hello, my name is Dr. Marty Martin, and I'm a faculty member at DePaul University and specialize in health sector management. So whether this is the first time you've actually watched this series, or maybe you're just jumping into it as a continuation, this particular series is called Quantitative Decision-Making Tools. That's a mouthful, but Quantitative Decision-Making Tools. So let's begin to kind of get an overview of what the focus will be today, but within context. So as you'll note, cause and effect is highlighted. That will be the focus for this particular module, but it's within the context of these other decision-making tools. So let's dive in. So fundamentally, when you think about cause and effect, something happens, either a good something happens or a bad something happens. And what you have to do is to ask yourself, the question is, what caused that? Yep, so what caused that good thing so that we can have more of that? What caused that bad thing such that we can prevent that? In fact, in healthcare, we often call this the 5 whys, or in some cases, a root cause analysis. So I'm not going to focus on that, but you may want to Google that or do some additional research on PubMed about root cause analysis or the 5 whys. Not only are they quantitative decision-making tools, but they're also good tools to use for quality improvement and performance improvement. But let's look at first defining the problem, or the effect, if you will. Step 1 is really knowing that there is a problem, that has to be defined. So that may seem silly, but problem recognition. Think about it. You're busy seeing patients, or you're administering things in a healthcare organization or long-term care organization, or you're working on projects in pharmaceuticals or biotech or medical device companies, and then something happens. So does that come to your conscious? And how do you categorize that? Business as usual, or is it a problem? Is it an opportunity? Is it something that's desired, not desired? Is it out of variance? So the first step is defining the problem. What's the second step? And it's really Royal's rule. And what Royal's rule is this, is define the problem once, but define it again and again. That's almost like the 5 whys. Because in a lot of cases, we may think that we're defining the problem, but in actuality, what are we defining? A symptom, but not the problem or the root problem. Define it again. Third step, Vince Roski's rule. So you really fundamentally, when you're thinking about defining the problem, is really ask yourself, what is the question? So sometimes the formulation of the right question can result in really defining the problem. Then you go back to Roy's rule, and then you have to redefine the problem. So when you're at this problem formulation or definition phase, this is not the time to be efficient. This is the time to be effective. And to be effective, you have to deliberate. So let's kind of move on and look at an example of what's called a cause and effect diagram, or a fishbone diagram. And if you'll note, you see the problem there. So that is, after you have actually defined the problem in a way that makes sense, then you want to ask yourself this question. What's causing that problem? Is it about people? Is it about procedures? Is it about policies? Is it about plant? So 4 P's, if you will. It could also be about processes and practices, 6 P's. But the focal point is you want to begin to categorize what the causes are to that problem. So that's one model of looking at it. Let's take a look at another model, which is the 4 M's, not the 4 P's. So again, you still have problem. We want to look at manpower, or person power, if you will, materials, methods, and machinery. So this is another way that you can look at it. If you really want to be very diligent and deliberate and robust, you would do both. So you would do the 4 P's, I also added 2 other P's, the 6 P's, as well as the 4 M's. So that way you can really not make sure or guarantee, but be more assured that you have defined the problem well and you are determining the causes of that. Now, you probably don't want to do this by yourself. So you really want to bring together a group of people and do it in a fashion that fits with the group. Because in a lot of cases, groups are a whole lot better than individuals with coming up different perspectives and different angles. So let's do an example in the real world, because some people are saying, 6 Ps, 4 Ps, all this stuff, M's, makes sense, but how is this really applied? So here's a case from the Cleveland Clinic. So before I actually dive into that, the Institute of Medicine in 2000 published a landmark book, which is based upon a series of studies called To Err is Human, Building a Safe Health System. And then there's an organization called the National Quality Forum. They have a number of different safe practices they'd recommend for better health care. One of them revolves around surgical site infections. So imagine this, is that you're going to get a knee replacement or shoulder replacement. You go to the hospital, get worked up, orthopedic surgeon's going to come in. All goes well during the surgery. Yep, not a whole lot of blood loss. Things are working the way that they should work. The implant is in there and it's operating pretty well. But maybe 14 hours after it, burning sensation, maybe a little bit of odor. So early signs of maybe a surgical site infection. Temperatures raising. So you really want to decrease the surgical site infections because they're quite common and they can cause a number of different problems, including mortality. So this is a busy one, so let's take a look at it. So if you note there, you see SSI, surgical site infection. That's the problem. You also will notice what's the health status of the patient as a causal factor. If a patient has diabetes, then it's going to increase the likelihood that there will be a surgical site infection. So what are the materials and the equipment that are used? Have they undergone proper sterilization procedures? If not, that will increase the probability of having a SSI. Technique. If the right technique is not used, that will increase the probability of having an SSI. Now we go down to the environment. So actually where the case is actually being done, is that cleaned well? And then clinical decision making, whether it's by pathway or process. So those are all actual causal factors that may result in an increase of SSIs. So then what you do for each one of those little branches is you examine that and ask yourself the question, to what degree does that attribute to SSIs? And then more fundamentally, what can we do to prevent that in the future? So another way of looking at these cause and effect kind of tools for quantitative decision making is to also put it on top of what's called a process map, if you will. So again, let's assume going in for shoulder, going in for a knee implant, so an ortho case, there are things that happen on a pre-op basis. So is there an assessment about diabetes, about my patient health status? Are the surgical trays, sterile as they should be? Is the proper protocol in place? Then there are things that happen intraoperatively, so they're scrubbing technique, and then post-op. So you really want to make sure when you do these cause and effect diagrams is not only do you look at the causal factors, but you also want to make sure that you look at the entire process, because certain parts of the process may be at higher risk. So hopefully you have a pretty good understanding about how to actually think about and use cause and effect. This next part that we're going to focus on is a time series analysis, and that's another tool.